Hi everyone. For today's case, we are going to be looking at impacted tooth number 11. So now, as you've seen many times, we're looking at coronal slice, sagittal slice, and axial sections, and here we have 3D rendering. Typically, I like to start out with looking at the axial views. So let me go up to the top of the volume, and I'm going to scroll through the axial slice through the volume, moving from the superior to inferior direction. And we're starting to capture root apices. So right about here is our area of interest. This is tooth number 11, and that is 12, 13, 14, and 15. So let me get to the bottom of the volume and then scroll back up again. Now I would like to rotate the volume so that we can look at a corrected sagittal view. Here again, let's start off from the buccal end of the volume and move more medially. We're seeing maxillary sinus and the sagittal view of the arch. Here we have again 11, 12, 13, 14, and 15. Okay, now let's take a look at the axial view. Let me start out from the anterior part of the volume and scroll distally. 9, 10, here's 11, 12, 13, besiobuccal root of 14, distal buccal and palatal root of 14, and 15. So now we're going to put our crosshairs around number 11 such that we're looking right through tooth number 11. Okay, so I like this view. One thing I want you to note is that the follicle of number 11 is very prominent. It's rather large within normal limits, I would say. And if you follow the buccal cortex cortical outline, you're going to see there has been some expansion and obviously a thinning of the buccal cortex. Here you can see the thinned buccal cortex. And the same is true for the palatal cortex as well. Thankfully, at this time, as I scroll through the axial view, it doesn't appear to me that the follicle has caused any discernible resorption of the adjacent teeth number 10 and number 12. And again, I can verify that looking through the sagittal view that there's no obvious signs of root resorption. Another thing that we can do is I can change the thresholding such that I can sort of peel away the bone. So here we can have a better appreciation of what's going on if you're not familiar with looking at cone beam CT scans. Again, this is a very limited field of view capturing part of the patient's upper left quadrant. Again, 9 and 10. Here we see number 11 and 12 and 13 and 14. In addition to the impacted or unerupted tooth number 11, what I want you to see is the position of these two premolars. Okay, when you look at these, given the amount of space that we have from distal of 10 to the mesial 14, I hope you can all agree that there's rather severe crowding occurring here in this area, and there's just not enough room for all three teeth to erupt. Upon careful examination, you also note that number 13 is more palatally located. So why don't we verify that? So that was number 11, by the way, right? 11. And here we have 12. So 12 is located here, and to me, the crown of 12 is relatively in line with the rest of the arch. But then if you look at number 13, the crown is definitely palatally tipped or angulated. So that's the full thickness of the ridge, and the crown is palatally located within the alveolar ridge. So that's another thing to note, and therefore there's high likelihood, obviously the decision will be made by the treating orthodontist, but there's high likelihood that one of these two teeth will be extracted in order to accommodate for the limited space. Okay, so that's what I wanted to discuss in this case, and I hope to see you in the next video. Take care.